Welcome, and thank you for joining us for the launch of Time to Focus. Today we're joined by hundreds of supporters, scientists and funders. We're delighted to have you all with us today. This event represents a vital moment in a hugely important project at Fight for Sight, our aim to put sight loss on the map. With the evidence base we're presenting today, we're confident that we make an unassailable case for greater investment in sight loss research. I'd like to give a special mention to the supporters who made this report possible. We're very grateful to the Cloth Workers Foundation, to Novartis, Roche and Santen for their support. Sight loss affects 2.5 million people in the UK, and that number will rise in the coming decades. And it has a huge impact on those who live with it, affecting their emotional, physical and financial well-being. Yet despite this, only a tiny fraction of the country's health research budget is invested into sight loss, which is simply not good enough. It's time for sight loss to be treated as one of the major public health issues of our time. Sight loss and blindness should not and need not be inevitable. Science has the answers, if only we can invest more in research. And the advent of COVID-19 actually makes tackling the issue even more of an imperative. The cost of not doing so will simply be too great. And that's why we're here today. It really is time to focus. In a little while, you'll hear from Professor Jonathan Grant, who'll present our findings. His presentation will be followed by a panel discussion, and you can feed in questions at any time by using the button on the left of the screen. Before that, you'll hear from Fight for Sight Ambassador, Professor Sepeng Kaur. We're delighted to have him with us today, fresh from the clinic. To ensure the technicalities don't let us down, we've recorded both their presentations, but we'll then move to a live panel discussion. If you have any tech issues, please try the alternative streams below the video screen or ask a question through the menu on the left-hand side. Now, let's get started by setting the scene of what's to come with our short film showing the personal effects of sight loss.
I'd never supposed that anything could go wrong with my eyesight. Throughout my life I've always been healthy, and then to be diagnosed with macular degeneration with its attendant threat of loss of independence was quite shocking.
By the time I was 16, sight loss had hit me pretty hard, and if I'm honest, I'd just mentally given up. I used to love all kinds of sport, but when my sight deteriorated, it all had to be dropped.
Yes, I think people do take sight for granted. Sight loss can happen at any point in someone's life. For Jackson, it's always been this way.
Mum and Dad were told that I had Leber's congenital amaurosis when I was really small. It makes things in front of me hard to see.
I hope Jackson gets to see so much more of the world.
Rather than an injection into the back of the eye, we are developing an immunotherapy to be delivered as an eye drop so that patients can self-administer at home. This will help to lessen the pressure on the NHS. What does that mean? It lessens the burden upon those affected, upon their families, and reduces the stress all around, and a significant reduction in sight loss.
I count myself lucky to have got help so fast. One eye is still failing, but the other eye, using treatment which has resulted from research breakthroughs, is now performing better than it has for a decade.
Choroideremia is caused by a faulty gene and leads to blindness. There is no current wide-reaching treatment.
Fight for Sight, thanks to the Tommy Salisbury Choroideremia Fund, funded the initial research that led to the world's first gene therapy trial. I was accepted onto a trial where a harmless virus carried my missing gene into the affected area of the eye. Thanks to Fight for Sight, I've regained some of my vision. It really does show what determined people can actually achieve.
Funding from Fight for Sight has helped us progress research into this type of eye condition. But one day, gene therapy could help with many other eye conditions, or even some types of cancer.
So revolutions in sight loss take time, but some are happening now. Our Fight for Sight is developing genetic techniques to tackle Leber congenital amaurosis. to allow more people to reclaim sight. But there are so many types, and treatments tend to be type specific. We're on the verge of life-changing cures. We are so close, closer to helping children like Jackson and so many others.
Now, I just want to go and do the things that I want to do.
It's funding that takes us step by step towards real change. It's change that is really needed.
Science is now making possible what simply didn't exist 15 years ago. But we need more funds for more breakthroughs.
We're on the verge of life-changing cures, but securing funding for additional research is vital.
And now I'm delighted to introduce our keynote speaker, Professor Sir Peng Kaur. Peng is Professor and Consultant Ophthalmic Surgeon at Moorfields Eye Hospital and Director of the UK National Institute for Health Research Biomedical Research Centre. The Ophthalmologist Global Power List identifies him as one of the most influential ophthalmologists worldwide. He's a passionate advocate for the power of research to improve patients' lives. He's helped build the world's largest children's eye hospital and clinical research centre. He was knighted for his achievements in 2013, and he's also an ambassador for Fight for Sight.
Hello. Thank you for inviting me to be here today, and I'm absolutely delighted to talk to you on such an important occasion. The Time to Focus report raises some very fundamental issues about the impact of sight loss and the need for life-changing eye research. It's vital that we give this topic and sight loss in general the time and attention it needs. All my career, I've seen the huge impact of research on clinical practice and how life-changing it has been for so many patients in the UK and around the world. So in this presentation, I'm going to show you now why this is such an exciting time for eye research, what the research has and could deliver for us, and why now is the time to step up investment in this area. Blinding diseases will affect everyone in this room to a different extent if we lead a normal lifespan. You, me, all of us. And therefore, this is incredibly important for everyone. Vision is our most valued sense all around the world. This is a YouGov survey we did with the Wish Foundation and Lord Darzi, looking at a survey of the importance of eyesight in compared to the other senses all around the world in many continents of the world. And you can see in the green bars, that is how they rated vision as their most valued sense all around the world. But we have a big challenge. The population is aging all around the world. And from the graph you can see there, there's an exponential increase in the number of people over 60, and that's paired by the number of people with visual impairment around the world. And that is rising very rapidly. But we have hope, and that hope is life-changing research. Innovations and breakthroughs have saved and restored the sight for millions of people around the world. All the major improvements in diagnosis and treatment have been based on research. Fight for Sight's founder, Norman Ashton, discovered the link between excessive oxygen given to premature babies and the sight loss that they suffered so catastrophically. This work has led not just to an improvement in the outcome for the children who would otherwise be blinded for the rest of their lives, but actually in insights to all types of eye disease, and including macular degeneration, and ways to think about how to treat that, and also to treat diabetes. In age-related macular degeneration and retinal diseases, some of the commonest causes of blindness in the world, again, in my career, I've seen life-changing research. When I was training, if somebody had macular degeneration, wet or dry, basically you would commiserate with them and you would register them blind. Since then, we've had an unprecedented understanding of the disease processes in everything from cell and molecular biology and genetics right through to epidemiology, trials, screening, that has revolutionized how we approach both macular degeneration and retinal diseases such as diabetes. The diagnostics, such as the revolutionary ability to image individual cells and tissues, new therapies, for example, the neutralizing molecules such as antibodies, have led to a revolution in treatment. This disease is now, or at least parts of it, are now treatable. And again, if you extend right through to screening, we've seen a fall in the number of young people between 20 and 40 blinded by diabetes for the rest of their lives. And this is because of the screening program and what we know through research. Future research also holds huge prospects for improving the disease. Our patients really want better treatments, including less frequent injections, perhaps better preventative treatments in the future, and also ways of streamlining how we care for our patients, such as in the clinic, so that they can be perhaps monitored at home and have occasional treatments for the rest of their lives. We've seen absolutely incredible changes in gene therapy and genetic diseases. Starting, first of all, with clinical studies and large groups for which the UK excels, gathering gene mapping with protein function, for which the UK has led in the world, new models of disease, therapeutic agents and new surgical techniques, human trials, and then, of course, the participation of industry. So that young girl you see there who had no hope in the past, when I used to see patients with genetic diseases in clinic, now have hope for the future. All because of revolutions in clinical studies, in genetics, and all the other types of studies that we see during research. This research is not going to just revolutionize eye disease. Coming soon to us will be vaccines for COVID. And one of the reasons we've been so relatively rapid in doing this is because they now incorporate gene therapy. And so the things that we've learned from all this research into genetics and gene therapy potentially is of benefit to everyone on the planet. Glaucoma, another major blinding disease around the world. Again, there's been life-changing research in understanding disease, particularly in large trials. We've got much better diagnostics, including visual tests and imaging of the optic nerve and the retina. And we're now seeing a revolution in some therapies, including medicines, laser, including the LIGHT trial, showing that a simple laser treatment could control the pressure for up to more than 3 to 5 years now. And new surgery and devices and anti-scarring therapy. And I think future research right across the board offers us the prospect of much better treatment and prevention of blindness in this group of diseases. So we've seen that research is life-changing. Certainly when I was training, I always used to think someone else will do it. But actually that someone is us all. I remember years ago seeing a child with severe glaucoma, with severe complications, and in those days, there was very little I could do. Since then, there's been a research program to address specific problems to do with glaucoma surgery. This is widely supported right across the board by charities, by government, by patients, and this has led to better surgical outcomes across the world. Better than that, it's led us to future ambitions, such as the so-called 10-10-10 project, to get the pressure down to 10, to make it last 10 years, and to do it in 10 minutes. If this was possible, this would open the door for treatment for glaucoma all around the world, including the developing world. The frustration we have at the moment is not that we cannot, it is that we can. Someone else won't do it, but we can do it together. None of the progress that you've heard about would have been possible or will be in the future without investment in research, investment that's presently lacking. Fight for Sight's analysis shows that only 1.5% of public grant funding is invested in eye research, even though 2.5 million people experience sight loss and blindness. The increase in the number of people with vision-related problems presents a significant and increasing challenge to our health and social care systems. Hundreds of sight loss conditions can be treated and prevented if diagnosed early, and this includes innovations that may make treatments more easily available in most parts of the world, including the developing world where there is much blindness. The Time to Focus report is so important because it clearly shows the enormous potential of research, not just to further science, but really to transform lives all over the world. Professor Jonathan Grant will present the report findings when he speaks after me. Fight for Sight's new costing model shows that by reducing the prevalence by just 10% in the next 10 years, we could change and transform thousands of lives and make vast savings for wider society. The need's there, the science is there, the talent is there, but at the moment the funding isn't. Sight loss is not inevitable. There is a UK sight loss crisis that the public and the policy makers need to be made aware of through all of us. The challenge ahead is huge, but we can and we must face it. This new insight provides the motivation and the tools needed to double the efforts to end this preventable crisis. There really is no time to lose. Thank you.
Thank you very much, Peng. Peng will be staying with us for the discussion after the presentation of the findings. Please feel free to send in your questions, which you can do using the button on the left-hand side of your screen. But first, I'd like to introduce you to Professor Jonathan Grant, who's going to present the key findings of the report. Jonathan is Professor of Public Policy at King's College London. His expertise lies in biomedical and health research and development policy, research and impact assessment, and the use of research and evidence in policy and decision-making. He is a Fight for Sight trustee and chaired the steering group that led on the development of this report. Thank you, Jonathan.
Thank you very much, Shireen, for that introduction, and thank you, Professor Sir Peng, for your extremely interesting keynote speech. As Shireen said, I'm Jonathan Grant. I'm Professor of Public Policy at King's College London and also have the honour of being a trustee at Fight for Sight. In my role as a trustee, I chair the Research Policy and Innovation Committee and also chaired the advisory group for this project, which has resulted in today's report, Time to Focus. What I would like to do over the next 20 minutes is to draw out the highlights from that report. And I stress draw out because there is so much interesting information and data that we and the research teams that we have worked with have managed to amass. It's a real challenge to really boil that down to a 20-minute presentation. But the sort of central theme I would like to get across to you is that now is the time to invest in eye research in the UK. And why is that? Well, first of all, as we'll see from the data, there is a need. When we have spoken to individuals who have various eye conditions, they tell us about the impact of those eye conditions on their daily lives. Some of that is what you might call social. It's about the relationships they have. It's about the quality of life they have. And some of that is economic. We then scale that up and look at the impact of eye loss on the UK economy. And again, we come up with some staggering numbers about the financial impact on the economy and how those impacts are not just around the health service and providing healthcare. They are broader than that. But more optimistically, when we look at the research, we identify a number of areas, as we've heard from Sir Peng, where there are real imminent breakthroughs with life-changing treatments on the horizon. And to ensure that those opportunities fully translate into the benefits for individuals with sight loss, we really do need to invest in research. And whilst we're currently underinvesting in research, the good news is that when you look at the impact of UK eye research, it is some of the best in the world. And when you look at the research that Fight for Sight funds, it is some of the best in the UK. So that's the case I want to put to you over the next 20 minutes or so. I'd like to begin by giving you some context and describe another public health crisis, that of sight loss in the UK. So let me set the scene. Right now, as we sit here in the UK, there are 2.5 million people living with sight loss. 1 in 5 of us will experience sight loss at some point in our lifetime. And every 6 minutes in the UK, someone will lose their sight. These are truly shocking statistics. But when we look to the future, we can anticipate they will actually get worse. Largely due to population aging, by 2050, there will probably be around 3.5 million people living with sight loss. And sight loss is one of those senses that people are most concerned about losing. When you survey people and you ask them about what terrifies them most, they actually put sight loss as one of the top of that list. So there's an imperative that we not only invest in research into sight loss, but we address this health crisis, and we do that through a combination of care. We do that through a combination of research. And if we take this a bit further and we look at the impact on the National Health Service, one of the really interesting things that I found from this report was that ophthalmology appointments, that is appointments around eyes, make up the largest representation of all outpatient appointments in the National Health Service. As you can see in this infographic, just short of 8 million appointments a year are made around ophthalmology, and that compares with 7.5 million for trauma and orthopedics. And this situation has been amplified during the pandemic. And obviously this is the case for all areas of health and healthcare, but we surveyed our community and asked them what the impacts have been on them during the lockdown. And 1 in 4 of the respondents we spoke to feared that their sight had actually deteriorated further during lockdown. And 2 in 5 found it difficult to social distance. And this is one of those sort of obvious type comments when you say it, but actually it was something I personally hadn't thought about. But it's clearly the case that if you are blind or partially blind, you are going to find it hard to socially distance when you're out and about doing your essential shopping or going to the doctor or such like. The other impact of the pandemic has been on our research community. During lockdown, we have seen, understandably, research labs shut down. And 9 in 10, 90% of the researchers that we fund have told us that their research has been delayed as a result of COVID. Now, in one sense, there's not much we can do about this. All of us have had to make sacrifices. But what we do need to ensure is that as we navigate ourselves through this pandemic, that we don't lose sight of the really important impact that blindness and partial blindness has on individual lives and how research can help address those eye conditions. And when we look at research, we find this historic underinvestment that has occurred for a number of years. In the UK, it's estimated that we spend about £1.4 billion on biomedical and medical health research. And when you look at individual disease areas, you can see here that eye research accounts for 1.5% of that, in comparison, for example, to cancers, neurological conditions, and respiratory diseases. And when you sort of calculate that by the number of people who are affected by sight loss, that is just £10 per person. If you compare that to people with dementia, we invest roughly £100 a year per person with dementia. So eye research is an orphan area, and we have to do something to address that underinvestment. And that was one of the motivations for us to come together and start work on the report that we are launching today. And to do that, we brought people from right across the sight loss sector, academics, practitioners, partners, collaborators, and commissioned a series of studies from experts in the field. One area we looked at was a series of surveys and interviews run by a company called Kaleidoscope that spoke to people who had sight loss, or were carers of people who had sight loss, or who were parents of people with sight loss. The next thing we did was undertake a comprehensive review of the literature, and colleagues from the London School of Economics undertook that for us. And they focused on the health economics, the economic cost of sight loss. And from that comprehensive systematic literature review, they identified just over 300 papers and used that to come up with both new estimates of prevalence around sight loss, but also estimated the economic impact at a societal level. And from that, they've managed to create a costing tool that we will also be launching today. The final element was a bibliometric analysis done by Clarivate, a company that curates the Web of Science. And this was an analysis looking at the research publications on eye research in the UK and internationally. And this analysis allowed us to benchmark both what we do in the UK and how impactful that research is, and also benchmark the research that we and Fight for Sight have been funding. So I'm now going to go into a bit more detail around the methods for each of those 3 studies, and then I'll draw out some of the key results. So if we look at the first piece of work undertaken by Kaleidoscope Research, what we were really interested in understanding was the personal impact sight loss has on individuals and families. And we did that through sort of 3 forms of data collection. We began with a series of interviews, which were quite in depth. And the purpose of these interviews were very much to help us sort of construct, if you like, what we would ask in the larger online survey, where we spoke to over 750 people. I should stress that we made the option of completing that survey online or through telephone interviews to ensure a degree of accessibility. And then as our research was disrupted due to the lockdown and the COVID pandemic, and we realized that some of our emerging findings were likely to change as a consequence of that, we then went back and spoke to another 300 people online, using, again, interviews to really drill into what's the impact of the COVID epidemic. If we move on to the work done by the London School of Economics, this was very much focused around health economics, as you might expect. And the team of researchers led by Professor David McDade identified 315 studies that looked at the costs of sight loss. And using those studies and looking at data around prevalence of sight loss, they were able to estimate various data points about the cost of sight loss for different diseases and to society as a whole. And from those cost estimates, as you will see, we are able to make projections into the future of both how much sight loss will cost us, but what the potential savings could be if we could reduce its prevalence due to high impactful research. And then finally, as I already mentioned, we asked Clarivate to undertake a bibliometric analysis for us. And this analysis identified over 500,000 research publications. And we were able to map those research publications to understand how visible they were to researchers, how impactful they were to researchers, but also to understand the level of collaboration between different research groups and to benchmark research occurring in the United Kingdom versus other countries, and to benchmark research funded by Fight for Sight compared to other research funders. So those are the methods that we employed. So let me now begin by looking at some of the key results. So if we have a look at the survey data of those 749 people living with eye conditions, including family members and their carers, we found a number of really interesting findings, or at least I found them very interesting. The first is that a third of the respondents to our survey had more than one eye condition, and 2/3 were living with other health conditions. So when we talk about sight loss, we have to really understand that it's not just a single eye condition, and it's not just a single condition that people are living with. In the jargon, we call that comorbidities, but it's really important that we understand that both from a caring point of view, but also from a research point of view. We also identified that 2 in 5 of our respondents, 41% of them, said that they experienced depression and anxiety, which they related to their sight loss. So that means that one of those other health conditions that people are identifying are probably around mental health. Interestingly, and somewhat depressingly, a quarter of the individuals we spoke to felt that their sight loss had had a negative impact on their personal relationships. So whilst we're going to be talking a lot about the economics of sight loss, I think it's really important we understand those social and personal impacts as well, because they cannot be monetarized, but they are incredibly meaningful and important for the individuals involved. That said, when we ask the individuals about the financial impacts, it is unsurprisingly the working age individuals who felt that the financial impact of sight loss was most significant, with 1/3 of them struggling financially as a household. And 1/5 of our population we spoke to felt that they struggled to get the needs they needed to go around their day-to-day lives. Now, all of this is sort of pulled together when we look at quality of life scores. Now, quality of life is a metric that we use in health economics and healthcare to understand the sort of burden that individuals have from different disease groups and disease areas. And if you have perfect quality of life, which clearly none of us have, then your quality of life score would be 1.0. And as you can see here, we've rated the quality of life for mild visual impairment, moderate visual impairment, and severe visual impairment, and benchmark that against other disease areas such as hearing loss, asthma, diabetes, advanced breast cancer, arthritis, and stroke. And I think most important here is that at the bottom of this, those individuals who have the severe visual impairment are the ones that have the lowest quality of life score from these different conditions. And that, in one sense, summarizes and pulls together the findings from our interviews and illustrates the impact that sight loss has on the quality of life for individuals. And I think it's really important that we focus, if you like, on those individuals. Now, we move on to the work undertaken by the London School of Economics, where they reviewed, if you recall, those 350 odd papers on the costs of sight loss. And they pulled all that data together, they synthesized it. And from that, they estimated not only the total costs, which, as you'll see, is around £25 billion a year to the UK economy, but where those total costs come from. And the critical point to take from this slide is that the biggest pot is that informal care. The cost of care provided by family and friends outweighs the impact on productivity, and importantly, outweighs the impact on health and social care. Indeed, when you add all of that up, the health and social care budget, the direct costs, if you like, to the National Health Service and associated agencies, is about 15% of the total cost. And as I said, if you add all those boxes up, you get to around £25 billion at the bottom of this slide. And if you take into account the ageing population in the UK, you find that that £25 billion will likely be over £30 billion by 2050. And that is one of the reasons why it is imperative that we focus in on trying to reduce the prevalence of sight loss in the UK. And the way to do that is through high quality, impactful research. So if, like me, you find it hard to comprehend what £25 billion looks like, you can recut this data and look at the lifetime costs. And in this slide, we show that the lifetime cost of somebody born blind is around £600,000 versus around £75,000 for somebody of age-related macular degeneration and £50,000 for somebody with glaucoma. The reason the latter two are lower is because they occur later in life. And if you manage to reduce the prevalence of eye conditions by, say, 10%, you would save the UK economy around £3 billion a year after 10 years. And likewise, in a scenario where you reduce prevalence by 30%, the savings could be as much as £10 billion. But to reduce that prevalence, you need research. As you've already heard from Sir Peng earlier on this afternoon, we are at the cusp of a revolution in eye research. And we know that research does impact. It impacts on individuals. And this is a picture of Joe Pepper, who is on our panel this afternoon, so you'll hear from him directly. Joe was diagnosed with a degenerative eye disease at the age of 10. And his eyesight deteriorated, as you might imagine, from then. And he put his name forward for some groundbreaking research in around 2015 and took part in a gene therapy trial. And that gene therapy trial has had a massive impact on Joe's life. As he says here in this quote, not only did it stop his eyesight deteriorating further, but it even brought back some of that sight. So for those of you who are cynical about the impact of research, I think you just need to hear what Joe has to say and really understand how research can make a difference and improve the lives and well-being of individuals. But when we look at research across the UK, the other point to note is that the UK is a leader. Now, this graph is slightly difficult to understand, but what we have here is the number of times research papers are cited by other academics. And through that citation, other researchers are giving some credibility to that research paper. And then you have to normalize, in the jargon, those citation rates by the world average. And that is the line here of 1. So if you have a citation impact above 1, you're doing better than the world average. And you have it below 1, you're doing worse. Now, the first thing to note from this graph is that the UK average for all biomedical and health research is above 1. That's the blue line. The pink line is for eye research in the UK. And what you can see is that over the last 10 years or so, the citation impact of eye research publications has been on a steady increase, such that for the last 4 years, it has been above the UK average and well above the world average. So what that means in layman's language is that eye research in the UK is truly world-beating. And it's also the case that when we look at who funded that eye research in the UK, the research that is identified and supported by Fight for Sight has a greater citation impact than that of other research charities in the UK. Now, this is something we're incredibly proud of because it means that our peer review processes are identifying the best researchers and the best research ideas, and that we are able to fund that research and those research ideas. But we also know, and I know personally because I chair this committee, that there is much research that we don't fund, and we could fund because we just don't have the money. It is of high quality research that we'd love to fund, but we do not have the money to make that funding. So if we pull all of this together, what does this mean? Well, we've tried to boil it down to 5 recommendations. This was challenging, but the first recommendation is to government and funding bodies. And hopefully you would agree with me that we need to see an increase in investments in eye research in the UK. Now, we've set up a target of doubling investments in sight loss research by 2030. Now, that doubling is a bit of a heuristic. We've been very honest about that, but we wanted to set ourselves a challenge. And as I've already mentioned, when you look about how much research we spend on ophthalmology for those people who have an eye condition, it's roughly £10 per person in comparison to £100 per person who is living with dementia. Something I haven't mentioned But when we look at the eye sector as a whole, it is dominated by charities that provide really essential welfare and care for people who have sight loss. And we do not in any way wish to undermine the importance of that investment. But at the same time, we note that those eye charities only invest 3% of their income in eye research. And we would urge them to think about investing more of that income into eye research and join us in this fight for sight. And that gets us to the third recommendation, which is very much across the research sector. And not only do we, and this is for Fight for Sight, need to commit to invest more and to raise more money to invest more, but I personally think it's absolutely critical that we collaborate and work across institutions and organizations to ensure that we maximize those impacts and that we work together in a holistic and collated way. Our fourth recommendation is very much focused at the health service. And as you saw in the earlier economic analysis, the health service in itself doesn't consume all the impact when it comes to the impact on the UK economy. And therefore, it's important that we take a really holistic approach. But critical to that is focusing on prevention of sight loss. And then finally, to our supporters, who I know many of you have joined us at this webinar, just continue with that passion and that support, because it's through you that we can really end sight loss. It is through your passion and your commitment that you can help us support researchers who can develop those breakthroughs, who will improve the lives of people such as Joe, who are living with various eye conditions. So I'd like to leave you with one question, a question that I'm actually not going to answer, and that's, what's the cost of doing nothing? I would urge you to reflect on that over the coming days, because I think the synthesis of the data that I've presented here, of which much more detail is provided in our report, demonstrates that now is the time to focus.
Thank you, Jonathan, for sharing the findings. I'm sure many people will have questions and comments, so let's go straight into the panel discussion. So back over to you, Jonathan.
Well, good afternoon. I'm Jonathan Grant, and you've already heard from me, and I'm absolutely delighted to be given the opportunity to chair the panel this afternoon. We have about 30 minutes, and we've got 4 fabulous panel members who are introduced shortly. But I just wanted to set out right at the outset that on your screen, there is a button at the top, say ask a question. So if you have a question for the team, please can you submit a question? I will be receiving them. I'll be looking at them on my phone. So when you see me looking at my phone, don't think I'm watching the cricket, because I'm not. I am concentrating on your questions. And we'll try to put as many of those questions as possible to you over the next, to our panel over the next 30 minutes. So very briefly, on our panel, we have 4 esteemed guests. We have Sir Peng, who you've already been introduced to, who gave us a fabulous keynote speech. So thank you, Sir Peng, for joining us live this afternoon. We got Professor Marcella Votruba, who's Professor of Ophthalmology at Cardiff University. So thank you very much, Marcella, for joining us. We got Joe Pepper, who I referred to in our talk earlier. And Joe can talk to us about the personal impact of sight loss and how research has changed his life. And last but not least, we have Neha Isa Brown, who's recently joined Fight for Sight as our Director of Policy Innovation and used to work at the MRC and has over 15 years of experience working in research policy and science policy. So we have a truly qualified panel. So Marcella, I'm going to start off with you and ask you, I'm going to ask all our panelists this question. You've heard about the report, you've had the opportunity to look at it. What was the most surprising issue that came out of that report for you personally? I'll start off with Marcella and then I'll go to Joe.
Thank you, Jonathan. Well, in many ways, it was the sheer scale of the numbers, specifically relating to the quality of life and then the economic costs. Because those of us working in the field may not have been entirely surprised by the content. For many years, we've known and suspected and had anecdotal, if not some studies that back this type of evidence up. But this is a fantastic report because it gives us the tools, it gives us the wherewithal to actually really quantify this for the first time systematically and take the evidence to the government and to other funding bodies so that we can actually start to talk about really very concrete issues of this epidemic.
Thank you. Joe, and then I'll go to Neha.
Thank you, Jonathan. I think I agree very much with Marcella that the sheer scale of the numbers is quite almost intimidating, a task that perhaps that we now need to look at and take on. But actually, I do entirely echo those comments about the quality of life scores. The fact that sight loss comes below arthritis, below depression. These are those clinical areas are spoken about so much in society, but actually sight loss is not. And actually, it made me genuinely think about my own difficulties growing up when I was, perhaps as a teenager, when I was losing my sight, I wasn't really aware of the actual social impact that my sight loss was having. But actually, when I would wake up in cold sweats, almost dreaming that I can see only darkness, those figures and reading that report actually really brought home to me that struggle that I had, and actually brought a sense of relief that actually I was one of the few people so far that have had the opportunity to live beyond sight loss and not fear it.
Thank you. Neha?
Thank you, Jonathan. I think I agree with both Joe and Marcella, and the shock factor is high. So I would say my least favorite shocking, surprising figure was that given all that we've heard, that the investment in research, in eye research, is still a shocking 1.5%. And moreover, that given all those figures that we have just, and the scale of that, Fight for Sight is the only national charity wholly focused on eye research. I think there is an imbalance there. Certainly that needs to be corrected. Given that, and despite that, actually, it's not very often that you share a virtual room with a real life example of the power and extent of research. You would have heard from Joe earlier of the transformation that research is able to bring about. I think that for me is shocking.
Thank you. And Sir Peng, do you want to finish off on that question?
Yes, sorry, I dropped off for a bit there. I think, as you had Marcella say, the scale of the impact of sight loss, particularly the impact, the modeling of just reducing by a small amount the amount of eye disease, the huge financial impact, but of course, for all of us who see the impact on our patients, the commensurate emotional benefit it would give to have even a relatively small impact on the prevalence of eye disease. So for me, that was the most exciting, one of the most exciting things about the report.
Thank you. And we got our first question coming from our audience, and it actually relates to my shocking statistic, if you like, which was that comparison between the fact that we spend £10 a year per person with some form of sight loss on research versus £100 a year versus somebody who's suffering from dementia. So that's a tenfold sort of inequality there. And I guess the question from the audience here is, why is funding so historically low when we look at eye disease? I'm going to start with you again, Marcella, on that, and then come to Peng and Neha, and then Joe.
Thank you. I think there are two answers to this. And the first one is a very sad thing to have to say, which is the unseen, the unheard, and the untreatable in the past was pretty much a summary of the field. And this was a dreadful thing and a terrifying thing to reflect on. And obviously, we're hoping that that's changing now. But more concretely, I think that some of the new treatments that we're going to need for the untreatable conditions in ophthalmology and vision have taken time to mature, and they've been through the cancer cycle, if you like, of patients who have life-limiting, life-threatening conditions. And in some situations, that has broken the mold, if you like, in terms of our ideas of what is achievable. It's not always the case that other fields would lead the way. Ophthalmology leads the way in lots of new therapies. But I think that we can't afford to give our patients a dangerous treatment which would be life-limiting, because obviously their sight loss may not warrant that. And so I think that the time is now right for us to adopt these new therapies which are becoming mature enough to apply in the eye to a large scale. And I think that ignoring the sight loss of the past was more about the fact that it was unseen by the rest of society, and we have to change that.
Brilliant, thank you. Peng?
I think ironically it's down to a word, visibility. Because I think diseases, dementia have very high visibility, and as a consequence, very high advocacy. And I think for us, it's a matter of trying to lift up eye disease and the importance of eye disease. Saw the survey around the world showing that people rate the loss of vision more than any other sense, way above anything in virtually every continent on Earth. And so really it's a question of increasing the visibility and the advocacy we produce for eye and research so that it's to equivalent levels.
Thank you. Neha, you've had the opportunity of working for the Medical Research Council, which obviously looks at all areas of biomedical and health research. Why, from that perspective, do you think ophthalmology research and eye research is such a poor cousin?
I think precisely as Marcella and Zepeng said, it's visibility. It is competing with so many other conditions which have previously got a lot more attention. And I think that the answer to your question is precisely the reason we conducted this research and commissioned this report, to actually shine a light on the scale of the problem and also the potential of the research and researchers in the country that actually can address it. But you gave the example of dementia research, Jonathan, which again funders such as UKRI, MRC have their agenda, and got calling as part of this report for collaboration to catalyze research in this area, to make sure that the government gives it the same attention, for example, as it gave a few years ago in 2012, 2015 to dementia research, which increased the level of investment, doubled it. And that's exactly what we're calling for, because you have a very good example of where, if the right attention and focus is given, change is possible.
And Joe, to use a sort of slightly abrupt term, as somebody who has both sort of suffered from sight loss but also benefited from some cutting edge research, do you actually feel, in Marcella's word, unseen when it comes to these investments?
I think for me, the principle of being unseen, I think, is totally understood in a historic context. Many people with sight loss have been told that there is no opportunity out there. Originally, when they were diagnosed, when I was 9 to 10 years old, I was told that there was no cure. There was no way that my sight would, that I would not lose my sight. At 16, I was told that I would lose my sight in the next 15 to 20 years. At 23, I regained 4 lines of vision in my right eye, stopping 10 years worth of degeneration, all because of cutting edge research that replaced the gene that I never had. So yes, historically, it's been unseen, but we now need to let the world, let our government know, let other governments around the world know that actually we can do something. I really want people that are listening today to take the opportunity to recognise that, yes, £25 billion is spent in the UK economy on those with sight loss each year. Only 1.5% is funded in medical research. Those two numbers are distinctly apart. But as Zepeng has said, and as the presentations of today has said, and the Time to Focus report shows, if we could narrow that gap by a fraction, then more people will have the opportunity that I have. sorry if my answer is slightly long, but I think people should recognise that the day that I read 4 lines more than I ever could imagine seeing, I remember like the back of my hand. I remember the time, I remember the smells in the hospital, I remember the nurse, Anna, who'd been with me for such a long time in my fight, for my own sight. And we both wept in tears of absolute joy. And my father turned round to me when I turned round the corner and he asked, "What's wrong?" And I couldn't reply. And Anna simply said, "Nothing's wrong." History has said that we can't deal with sight loss. Today, this report, Cutting Edge Science, says that we have an opportunity to do something about it.
Brilliant. Thank you, Joe. And just sort of taking that theme, and probably a question for our 2 scientists on the panel is, and we heard a bit of this from Sir Peng's keynote speech, but when we look forward the next 10 years or so, and this is something as a sort of layperson coming into this field, I've taken away from this, is it seems to me that we really are at the cutting edge of some sort of extraordinary breakthroughs where we can reverse sight loss, as Joe has so passionately articulated. Scientifically, what is at that cutting edge today, and what are the consequences on it for people like Joe and future people who maybe get diagnosed at a younger age and follow in Joe's footsteps? And what are those breakthroughs, and how confident can we be that they are going to come around in the next 10 years, say? Marcella, sorry, I should ask you first.
Well, I'd like to emphasize what Joe has said, but I would also like to emphasize that we have enormous opportunities to both prevent, diagnose and cure blindness in more common diseases. And I think perhaps if I start by saying I think that there's been enormous change in our ability to treat glaucoma, which I'm sure Sir Peng will talk about, in AMD, where there's still obviously much to do, but then in the rare diseases, which are the genetic diseases. So the real answer to your question, I think, is that the change that's the most fundamental, as I see it, is our understanding of the human genome, genetics, proteins, what they do, what goes wrong, how we could repair this, and whether it applies to a disease which is caused by a mutation in one gene, such as that experienced by Joe, or a combination of factors that result from genetic changes interacting with the environment. All of that's driving enormous change in our ability to design therapeutics, and whether those are drugs, therapeutic interventions that modify the disease process, stem cells or cellular therapies or gene therapies. We're really at the cusp of a massive revolution, which is starting to bear fruit for the first time, and it's absolutely terribly exciting.
Thank you. Peng, you commented on some of this in your keynote, but do you want to amplify some of your sort of aspirations for the next 10 years?
Yes, I think although people always think of sort of different types of research, and particularly laboratory research, as being highly esoteric, it's not. Because I think some of the treatments that are being developed, such as stem cell therapy, are very close to coming for one of the commonest blinding conditions in the world, macular degeneration. Also, we already have positive signs that could work. And as our population ages, more and more people will get problems with them. So this is exciting because it's actually generative therapy as opposed to one that stops a basic problem and needs an injection every month, for instance. I think the gene therapy that we've been talking about, Joe, again, that's been spearheaded by the rare diseases and has absolutely transformational for individuals who would otherwise have lost their sight. But I think now some of those technologies are being transformed into commoner diseases like macular disease and glaucoma. And again, that, not forgetting that gene therapy is something that's coming to all of us very soon in terms of vaccines. So it's going to be much more commonly applied. I think better surgery, surgery has revolutionized ophthalmology, the way we do cataract surgery,
instead of 6 weeks off in Downton Abbey, you can now come in and have it done in half an hour. And surgery for glaucoma and other diseases also speed up, see if they can be fast and practical for delivery around the world. And finally, I think diagnostics and the sort of adjuncts like artificial intelligence may seem a bit esoteric, but if you can see somebody, photograph them, make a diagnosis of blind disease by the intelligence team, and then you treat them, do that to a much larger population of the world. So I think it's not just for rare diseases at the moment, it's going to be for common diseases, much faster treatments, more convenient treatments that can in some ways stop the disease, or even in some cases reverse disease. That's going to be very exciting future ophthalmology research.
Thank you. And we've just got quite a tricky question, I think, which I'm going to put to you now, which has come again from our audience. And we demonstrate in the report that the sort of sector as a whole spends just 3% of their budgets on research. And as Neha has already said, Fight for Sight is the only charity that spends 100% of its income on research. But given that we have shown in the report that the largest costs are associated with informal care and lost productivity, isn't it actually making the case that we should be investing more in care and less in research? What's your response to that? Why does research matter when we also need self-evidently these investments in care? Neha, I'll start with you and then I'll go to Joe.
Sure, Jonathan. I think the answer is simple. As long as the support and care is absolutely vital, there is no doubt about that. And when we're not making, just to be clear, a case for disinvestment in that, we are instead making a case for more investment at upfront. The reason being that where people are living with preventable sight loss, it is much more prudent to invest earlier on in research to prevent those people from progressing to a state where they will need more care and support, which ultimately is only, in the end, trying to manage the effects of a condition, not addressing the cause or finding a solution. So in terms of why this data and exactly that such high costs related to informal care outside of social and health care means that we need to start thinking of the solutions, not just managing the effects of it.
Thank you. Joe, do you have a comment on that one?
I do actually. My family circumstances is perhaps a little unknown. That 3 months after being told that I wouldn't lose my sight after my gene therapy, my cousin who has glaucoma lost his sight entirely. It was something that both myself and him didn't talk about for near on 2 years, and was perhaps a bit of the elephant in the room amongst our family. And I felt a deep sense of guilt for so many of for those whole months until we actually took the opportunity to properly sit down and talk about it. And without River, his guide dog, he would not be able to live an independent life. So 100%, as Neha said, we're not saying stop funding, support and care for those that have lost their sight or who are severely have lost their sight. We're saying let's guarantee that more people in the future are not losing their sight, so that the report shows a very, very stark number when it looks at 2050, when we are verging beyond £35 billion of the economic impact of those with sight loss, with then 3.5 million people in Britain alone that will have lost their sight. So if we as a society now want to accept that those will look back at us with this opportunity that we've been given, that we didn't do anything to try and stop those people that could have had their sight saved losing their sight, then I don't think that's one in which we can totally sit here and say we're happy to do that. And actually this report shows that we've got an opportunity. As Sir Peng and Marcella have said, mine's quite a unique case. It's a gene therapy trial. It is a rare condition. the data is being used for other gene therapy trials and other clinical treatments, but actually there's so much research out there that will help us solve and prevent the more common areas of sight loss. So actually, it amazes me that we even are contemplating not investing just a little bit more to potentially impact people's lives, whilst also guaranteeing that those with sight loss at the moment do get the care that they need.
So Joe, sorry to cut across you, but another question's come in, which I think picks up quite nicely on what you just said there. And the question is, what is the best way for sight loss charities to collaborate? And Joe, I'll ask you to pick up on that, because I think it follows the response you just gave me. And then Neha, I may ask you, wearing your Fight for Sight hat, to also make a comment on that. So Joe?
I think there needs to be an acceptance that we all, everyone that works in the sight loss sector, whether it's research, whether it's care, we all actually have one aim, and that's to improve people's lives. And we need to have, perhaps it is saying in after this report that we come together as a genuine eye research working group that is with Fight for Sight, with other charities, with the Medical Research Council, with government. And we're saying that this is a public health crisis. So let's all get together and work out how we best use the funds and how we best tackle the problem.
Thank you. Neha?
I think absolutely, I'd agree and extend Joe's argument in saying that we know that as research charities, and actually it's quite poignant that just today a parallel report from the Association of Medical Research Charities highlights the crucial role that the charity sector plays in the UK life science sector and providing research and treatment to patients. And I think this report from Fight for Sight does emphasize that point, that we, for example, have to increase the charity spend, which is also very, very, very low, of 3% on research. And that figure needs to be balanced. The model that we produce with London School of Economics gives us the tool to see where we can direct efforts, collaborate more and better to target those areas that are high prevalence and also high impact and cost, both to people as well as the society. And lastly, I think together all of these should enable us to come together as a sector, all the way from research through to care and support, to urge the government to build a national plan for vision loss, which, as the report demonstrates, is becoming increasingly a huge burden on the NHS now and later. We are a growing population, and a population that is aging. So this crisis of sight loss isn't going to go away until we collaborate, but also focus at research, trying to find solutions, not just managing the effects.
Thank you. So I got an email, I guess, or a comment from one of our audience members that I'm going to read out, and I'm going to ask Marcella and Peng to comment on it, and then we'll begin to wrap up. I've got one very specific question for Neha, and then I'm going to ask each of you to respond to a closing question. But the comment we've just received is, and it's slightly long, so be patient with me. When I lost my sight, it took 9 months before I was given a diagnosis, and having got to that stage, felt I was dropped with no support network. I walked out from hospital in tears and in fears. I have now gone overseas to receive pioneering therapy, but had to find it myself, as no one was prepared to provide the information about what opportunities might be out there in the wider world. Ophthalmology and neurology need to work together. So the reason I wanted to just put that on the table, because that's another sort of twist of that collaboration and partnership and working together question. So Peng, maybe I'll ask you to comment on that, and then Marcella.
Forgive, I missed one or two components of that, but I think the gist of the question was that the different organizations weren't working together well, and how do we to put this together and that we our patient the best they can. I mean, I have to say that story, I've heard that story before when previously patients had been told that there was no hope and they were just discharged from the clinic, and this huge sense of despondency and difficulty that brings. And I think that is changing. That is changing and has changed very rapidly. I think research and the sort of research impetus you read in the Fight for Sight report brings, should and does bring in to the clinical side the fact that there's many ways you can help people in their pathway. And I think that can help to integrate services, because you see, research isn't just about, you know, molecular medicine and how it works. It's pathways, research into the pathways. You have a problem, you want to be transitioned nicely through the different pathways. You want it done efficiently, you want it done quickly. And let's say with modern genetic diagnoses, we may be able to make the diagnosis that was missing in the questionnaire for so long. Now we may be able to make that with the new genetic services that are arising in the UK, for instance, much more quickly, and therefore give individuals a much more better pathway to what treatment they need, what support they need, then take that. So again, research has and will help this whole issue move forward into the future. Thanks.
Thank you. Marcella, do you want to comment?
Well, I just think the question touches perfectly on two things that are really crucial here. One is the human aspects of this, the delivery of care and the way that we support people. And whilst that's not perfect, I think it's still paramount that we try at all costs to improve that by integrating services. We hear this so often in rare diseases and childhood diseases, where children and families are passed from clinic to clinic to clinic with no diagnosis. And I think that is changing, because diagnosis, even in the last 5 years, has improved tremendously in many of the rarer conditions. The second thing is, what better advocate, if you like, for more research could there be than to say that there might have been some trial in another country that the person couldn't access, perhaps in the UK. And of course, we don't know the details, but what better thing could you say about the fact that we need more research, in that if that trial had been successful and the treatment had been shown as valid, then we would all hope to benefit from that. We would aim to incorporate it within the NHS, disseminate it, improve upon it. So in a way, that I think the question has two huge components, both of which are vital. And I hope that both are improving, but I do acknowledge patients do have these really unfortunate and unpleasant experiences, but hopefully less in the future.
Thank you, Marcella. So I'm very conscious of time, and that there's tons of messages coming through on my phone at the moment, which we're not going to get to, but we will sort of capture those on the Fight for Sight website and do our best to respond to them. So if you have submitted a question and we haven't got to it, do look at that in the next week or so when we're try to answer it. But I just want to finish off with a sort of comment question from another member of the audience for all four of you. But given time, I appreciate if you could be brief. I'll start with Joe, then Peng, then Marcella, and then I'll finish with Nihar. And the comment is, thank you, terrific webinar. How is funding going, and how can we all really help? Any ideas? I've changed my will recently in favour of sight loss, so hopefully others will consider this. Please let us know how we can best help Fight for Sight with regard to these changes. And as I asked you, just comment on that and respond to it. Just want to stress it's not just about fundraising and money. Now, clearly, we've demonstrated, I think, in the report that there is a need for further research. And we've also demonstrated that the UK is truly world beating when it comes to research, and the research that Fight for Sight funds is leading in the UK. But there are many ways that individuals can participate and support this really important work, some of which, like Joe, is actually participating in clinical research. So the question is how can people listening to the panel this afternoon really help? So Joe, I'm going to start off with you on that.
As I hope people have realised that actually the future is very much ours. We have a genuine opportunity to enact some form of change for those that suffer sight loss. And actually, yes, funding is brilliant, and fundraisers giving your money and doing challenges through wills, whatever it is, to Fight for Sight or other research charities is fantastic. But the big thing that I hope you've realised is that no one really recognised the scale of the problem. And the thing that I'd ask you is, yes, we've had an opportunity to now, this time to focus, but there is no point focusing if we don't do something about changing it. So if you have an opportunity to talk to people, to tell people, to join our campaign for medical research, for more funding, the voice now needs to be heard, and people listening today need to know that sight loss can and will in the future be tackled more effectively with more funding. And we need your support, your voice in doing that.
Thank you, Joe. Peng?
I think you can help. I go back to that word visibility and advocate, those words,
Yeah.
visibility and advocacy. Get out there. It's in the Fight for Sight report. It's in the thing. It makes a huge difference. Sight is really important to people. Advocate, and get in the news. Tell everybody, tell your MP, because really, in this modern world where there are many types of media and other things competing for everybody's attention, particularly at the moment, you can't say enough to advocate and use the tools that you have in this report to help you tell everybody, tell people how important eye research is and how life-changing life research is to people.
Thank you. Marcella?
One thing that strikes me is that it is a partnership between patients and their professionals, whether it's in the laboratory or in the clinic. And the thing that's really vital there is the ability of the patient's voice to be heard in terms of what they would like us to work on, what they think of our progress, what priorities they regard as important, and also whether they're willing to then take part in all forms of advocacy, whether it's in patient consortia helping to design clinical trials, even just in these types of surveys where we're talking about the effects of sight loss. I would encourage all members of society really to realize that it's about us. It's not about us and them, because we could all be affected by sight loss. And I wouldn't want to leave it all to the patients too. I believe we had to have strong advocacy with governmental organizations, because to tackle the level and the scale that we have seen in this report will not be fair to put the onus on those individuals who are affected by sight loss. Clearly, it has to go to a governmental level so that we have more affordable and immediate treatments for such a range of conditions.
Brilliant. Thank you. And Nihar, the final comment?
I think this all sums up very nicely all the various aspects and perspectives you can bring. Marcella stole my line, and we are very keen at Fight for Sight actually to build a very robust patient public engagement and involvement sort of aspect, because exactly this is what we want to take this research, the report and the recommendations from it, and hear you and hear your voices. I think what I would say is that allow us to take the pioneering research that we have demonstrated we're very good at finding and supporting to a stage where we have not just one Joe, in a panel being the spokesperson for the transformative changes research can bring, but many, many such patients whose life would have changed. And in a nutshell, I would say, just help us fight for sight.
Brilliant. Thank you. Thank you very much, Nihar. And just to add to that, if you want to get involved in whatever way, feel free to go to our website. You have our contact details, and we can speak to you about how you can contribute to this sort of Fight for Sight, as Nihar just said, and help us take forward this report and ensure that it doesn't get stuck on a bookshelf, but does actually lead, if you like, to the transformative change that I think all our panelists in different ways are strongly and passionately advocating for. I'd just like to finish before I hand over to Shireen to thank our 4 panelists. There was really, I found it really informative and insightful set of comments. I hope our audience did as well. And also I'd like to thank our audience for taking the time to be with us on a sunny afternoon to listen to the research that we are publishing today, and to join us, if you like, in this call for action and this call to focus on eyesight and eye research in the future. So thank you all very much, and I'll hand back to Shireen.
A huge thank you to our panel chair, Professor Jonathan Grant, and our keynote speaker, Professor Sepeng Kaur, to Joe Pepper, Professor Marcella Wotruba, and Dr. Nehar Issa-Brown. And thank you very much to all of you for joining us here today. You'll find the full Time to Focus report, as well as our new costing model and all the source reports on our website at fightforsight.org.uk. This is, of course, just the start of the conversation. We'll be using these findings to work in collaboration with our partners, supporters, government and policymakers to bring about change. I hope this event can mark the start of even closer working together in our mission to create a world that everyone can see. Our time today is just about up, but just before we go, I'd like to leave you with a very short film which really focuses on some of the voices of people who live with sight loss, because after all, they're why we're all here today.
As a type 1 diabetic, you understand that there's going to be things wrong with your eyes, or possibilities, complications. But when retinopathy was mentioned, I had no understanding.
And for someone who had worked all her life very independently and travelled independently, suddenly to have difficulty going down the stairs or crossing the road can be a nightmare.
Because when you have a sight impairment, it's not only the bigger picture that's affected, it's the small things as well, such as being able to work out someone when they walk through the door or make eye contact.
Charles Bonnet syndrome is a visual hallucination for people who have had sight and then lost it, so it's not the nicest of experiences.
It does cause quite a few issues with daily life. At the time I was serving in the military, my career was cut short to 14 years.
My maternal granny Megsie had glaucoma, which impacted quite vividly on her in the latter part of her life.
I have a hereditary eye condition which is degenerative, so it means I face the very realistic probability at some point in my life I will go completely blind unless a cure or a solution can be found, and this is something that genuinely worries me about the future.
My son James has Stargardt's disease, which means over time he'll experience severe sight loss, and unfortunately it's already affecting his day-to-day life.
I have a little girl, and one day there is a chance she may get diabetes, and if she does, and she doesn't have to go through all the appointments and the eye drops and the laser and the operations, don't want her to have that.
It's paving the way for more insight for the future and hope.
They can live their life as easy and as fluidly as possible.
We need pathways, we need research. The more we raise this awareness, I think it's going to help so many more people out there.
Our eyesight is the most valuable thing that we've got. You know, if there's a cure out there or something that can help to see the world that we can see, well, that's just invaluable, really.
My mum found out that she had a predilection to the condition, so she was able to access the really remarkable treatments that are out there. Science has the answers. The only barrier to all of this is, as ever, funding.
Although personally I would not wish to have my sight back, but I do really want any children of mine to have an option and to be able to choose, if they could have sight, to have it.
Overall, only a small percentage of medical research funding goes into eye research, even though we know science has the answers. More needs to be invested in research to stop sight loss and blindness